Dr. Strand, thanks for joining us this morning. I guess, first of all, congratulations on the appointment from Akron Children's Hospital.
Ray, thank you so much. It is such a pleasure and a joy to be in the Akron area again and to have this opportunity to really serve moms and families in this region.
Well, when you talk about, again, give the background, because you've been a couple of different places and now you've come back to Akron. So talk about what led you back.
Well, so I actually did my undergrad studies at the College of Worcester, just down the road, and fell in love with the area then. And really, Akron Children's is such a jewel to have the opportunity to come and work at an independent children's hospital that has all of the services of Akron Children's and serves this region so diligently. It really was an easy choice to come here and bring the family and take this opportunity to see how we can really improve or increase access, not just to neonatal care, but to all of the prenatal care, just like you say, the perinatal care for these families with high-risk pregnancies and complicated babies.
And when you talk, Dr. Strand, about the facility we now have at Akron Children's Hospital, I toured the building when it first opened up. It's something else, and it's even gone farther with the endowment there from the Crowley family. But talk about our facilities and the type of care we were able to produce through Akron Children's Hospital here locally.
It's really amazing for a hospital like Akron Children's to have the breadth and the depth of pediatric expertise. I mean, we have specialists in every field of pediatric medicine that are able to support those complicated and complex tiny little premature newborn babies. The facility it's unparalleled. It's just beautiful. And not only is Akron Children's providing care in downtown Akron, but the Boardman campus and the outreach that Akron Children's is able to do because of the generosity and the resources provided by families like the Crowleys allows us to really reach out and find those families that otherwise wouldn't get the highest level care and provide that for them here at Akron and help them to stay local so they're not having to travel hours and hours away to get the care that they need. It's really amazing.
Yeah, with us is Dr. Marya Strand, again, the new chair of the Neonatal and Prenatal Medicine at Akron Children's Hospital, and the care of the family. And Dr. Strand, I'll let you elaborate here, though. It's emotional times. I've been there. The incubator health is emotional. I've been there. And what we've done with Akron Children's Hospital, maybe you can talk about now and how it looks to even be improved going down the road, is to calm those emotions of those families and the baby itself through this care that is top-notch here in the Akron area. Individual rooms, the incubators themselves, such top-notch at Akron Children's Hospital.
Well, it's amazing to think about. And, I mean, you probably are familiar, having had premature twins yourself, with how young this field is. The field of neonatology is really, it's less than 100 years old. And so the pace of change and technology advances is just, it's mind-boggling. And so the way that Akron Children's has really kept at the forefront of all of that technology, from the prenatal care and the high-risk OBs who are able to provide earlier and more precise diagnoses to help. I mean, you've been there. You know there's nothing more stressful than getting a diagnosis when pregnant that something is going on with your baby or babies. And then you just wait and you wait and you wait for the doctors to tell you what's going on, for them to deliver, and then you wait some more as you wait for them to get big enough to go home and see who they become as little people. And so being able to provide information earlier, being able to support the families better through both the technology that Akron Children's has, but also the other services that Akron Children's has. The support, the psychology, the family support, the Ronald McDonald House, all of the things that go into helping families cope with really the highest stress situations that a family's going to face. That's what really sets Akron Children's apart, I think, and was so attractive when talking about coming to help lead a department like this, is that it's not just the technology, it's not just the incubators and the monitors, it's the whole wraparound care that Akron Children's can provide for these families, from before delivery to after delivery, and then to long-term for kids who need long-term care. They don't have to travel to other places to get that subspecialty care. They can stay right where they've been and know the faces and know their way through the hospital. And even that itself is pretty reassuring.
Dr. Strand, let me ask you this. What about going forward? And you mentioned, and I think you hit the nail on the head, we're really just starting to grow infant stages still with this prenatal and neonatal care, and certainly the expertise in those certain areas. But what do you see technology-wise even to come, and maybe this endowment from the Crowley family can help lead the way in that area? But maybe talk about what's next in this type of care.
Well, there's so much. There's so much. How much time do we have? The Crowleys and their generosity can't be overstated. The fact that, they had a premature baby. Now she's an adult and thriving and has her own family. And the fact that they can tie that success back to the care that they received at Akron Children's, I think speaks to the importance of how we support families through this time. And so, yes, their generosity is going to carry the field forward for Akron Children's, and I'm thrilled to be able to help support that journey. I think as we talk about technology and cutting edge practice, there's so much that we're still learning about the prenatal care, perinatology, delivery room care, and then the long-term care of premature babies after that. One of the things that we really want to focus on in the coming months and years is understanding better how to optimize our care. And that requires what we would call clinical research or equivalency research. So if you have a mom who presents with this situation, what's the absolute best way to care for that mom and fetus? And so being able to contribute to the literature and tell the stories of the moms and the babies after delivery will help us provide better care, but will also contribute to the literature so that other institutions, other providers, other physicians can learn from that as well and provide best care to their patients also. So I'm really excited about the potential to expand our academic footprint, our scholarship here at Akron Children's.
Dr. Strand, congratulations on the appointment. Can't wait to see again what lies ahead in this type of medical care, and reinforces our medical corridor that we have in the Akron area. So I guess I can say welcome back to the area, and can't wait to see what you do there. And I guess thanks for penciling me into your calendar this morning. I appreciate it.
Oh my gosh, it's a pleasure, and I'm thrilled to be here, and I'll keep you posted on all of the great progress that happens.
Sounds terrific. Thanks, Dr. Strand.
Thank you.